Hi and welcome to my channel. I'm Yourbabysdoctor, your baby's doctor, and today we're talking about something very important. It's actually very important to the mothers, to the fathers, and the caregivers. This is one thing that brings everybody to the hospital. They come to the hospital because of teething. Yes, I know, like in this environment, I'm a Yoruba girl from Nigeria, and I know that everything that happens to an infant that is out of the ordinary is related to teething. Like if you think about it, if a child is stooling too much, the child is teething. If the child is not stooling, she's teething. If the child has a fever, she's teething. If the child does not have a fever, okay. Okay, so you get the point. Yeah, so that is what we're talking about today. We're talking about teething. If you're just joining me for the very, very first time, thank you so much for joining my channel. It is always very sweet to have new people here. Please click the subscribe button. It is right below this video. Click the notification bell so that I can get notified every time I post a new video, and click the like button so that YouTube can see it as an important video and make it available for people in the search option. So yeah, thank you so much for joining me. I'll be with you shortly and then we'll talk about teething. Alright, so welcome back. Let's talk about teething. So your child will start teething, or the tooth or the teeth will start erupting around the 6th month of life, usually between the 4th and the 7th month of life. But some people have recorded that their children started teething around the age of 3 months. Oh well. But yes, the common age is around 6 months. 4 to 7 months, your child will start teething. Although some children can teeth later, and then some can teeth earlier. Children are different, depending on even their genetic makeup and all. Children are different. So different children will teeth at different times. But what is important is that by the age of 2.5 to 3 years, your child should have his or her complete 20 beautiful primary teeth. Alright, so there are some things that you will notice when your child starts teething. And the very common ones are that the child is very fuzzy, the child is irritable, the child can have this swollen gum and can have this whitish discoloration of the gum. The child can start drooling saliva. Okay, so they start drilling that even if you put a cup, you might be able to get a cup full at a go. And yes, sometimes, the child can have a fever, although the fever is usually low grade and usually less than 36 degrees Celsius. So yes, it shouldn't be one very high fever that will be scaring everybody. So those are some of the things that your child can present with when they are teething. Some things that your child should not present with when they are teething, which is contrary to what they believe where I come from, Yoruba people. So they say, let me start with the first. So they say Igbeyin. I don't know what you call it in your language, but it basically means stooling that is associated with teething, or tooth stool. Yeah, so yes, if your child starts stooling, so has diarrhea, passing watery stools and all, please, that has another meaning. Of course, I try to relate diarrhea to teething indirectly by saying that the child, this is the age at which the child starts putting things in the mouth. So, of course, if proper hygiene is not met, the child can get infected from putting things in the mouth, and this can lead to diarrhea. I think that's a very nice explanation, because that's the only way I can explain a diarrhea that is associated with the time the child starts teething. Because naturally, a child should not pass watery stools when teething. Same with vomiting. Your child should not vomit when teething. So if you start seeing signs like diarrhea, vomiting, a rash, swollen, maybe cheeks, or redness on one side of the face, or convulsion, or something that is out of the ordinary, please, your child is not likely teething. Something else is going on in your child. I've already told you that the common findings are fever occasionally, draining of saliva, irritability, and swollen gums. Even the gums, when they are swollen, should not bleed. So yes, if your child starts bleeding around that period, please, it might mean something else. And these are reasons why you should get to the hospital. So what do you do when a child is teething? I mean, the child is irritable, so yes, every parent wants to soothe the child. You want the child to feel better. So some of the things you can do is to massage the gum. Okay, so I advise you use your fingers, but please, hand washing, wash your hands very well before putting your hands in your baby's mouth. So you wash your fingers, and then you put your finger in the mouth, and then you massage the gum. Okay, so you can actually see your baby feeling better when you're doing that. So you massage the gum. There is this silicone brush that is for infants. It has like bristles, but the bristles are like silicone. So you can also use that to massage your baby's gum if you have that. Another thing you can do is to put something cold, not ice cold, just cold in the baby's mouth, Like what? You can get like a gauze or a small napkin or washcloth, put it in water and put it in the fridge so it gets cold, not ice cold. It gets cold, and then you put it in the baby's mouth so the baby chews on it. And then of course this can also give a soothing relief. Another thing is this teether. You guys know the teeth, that thing that's like silicone. Some of them have fluid in it. You really can chew on it like a toy. Yes, and I like those that you can actually attach to your baby's clothes so that even when it falls on your baby's chest and not on the floor. Okay, so when you have that, you can also put that in the fridge, let it be cool, and then you put it in baby's mouth. Baby starts chewing on it, and then baby feels better. However, if these things do not relieve the fuzziness and irritability of the child, you can go ahead to get over-the-counter medications. Please remember that every medication, like ibuprofen and paracetamol, which are very common, also have their side effects. So please have this at the back of your mind before giving your child over-the-counter medication. Alright, so now that I've talked about the things that you should do or you can do to give your child a form of relief when they are teething, there are some things that you should avoid. Now, this first one is still on the scale for me. They are called teething biscuits. So they sell them commercially. They are biscuits with a lot of sugar and all those things. So yes, you have to weigh the benefits. I mean, is your child really getting much nutrients for it, or yeah? So the teething biscuit is a form of biscuits that you give to your child. Another reason why I'm not so keen about the use of teething biscuit is because it can break into fragments. It's a biscuit, so it can break into fragments, and if you're not careful, your child can aspirate the fragments and cause a big problem. So I think I personally would avoid teething biscuits. I don't know, whatever works for you. If you can actually supervise your baby when your baby is taking the teething biscuit, then you can go ahead to give your child the teething biscuit. One other thing to avoid are numbing creams. You should avoid anything that will numb your child. So there are some creams that have some things in them that have, like this one, that is one that has belladonna. These ones they've even been banned in some countries, but of course you can come across them. So please, anything that you see that they will say will numb the baby's gum. I mean, the pain the child is feeling is not that bad. So please avoid putting numbing creams on your baby's gums. Avoid herbal concoctions. I would always talk about herbal concoctions. Please avoid herbal concoctions and avoid random medications with names like teething something, teething liquid, teething powder, teething solid. Please avoid anything like that. There are even these teething tablets. Please just avoid it. I've told you, massage, cool, and of course, if you have to, you can give ibuprofen or acetaminophen. But please avoid unnecessary things, because your teething is not that difficult. We all went through the process. I went through the process. You went through the process. And everybody has gone through, and some people are still going to go through the process. So it's not a big deal. So it shouldn't give your child much problems. But like I said, if you're having symptoms such as diarrhea, vomiting, anything out of the ordinary, then you should report to the hospital, because you might just be dealing with something else. So before I go, I would like you to know that I understand that what brings you to the hospital, or what makes you seek all those advice, or what makes you go for all those teething powders, teething biscuits and whatnot, is because you care about your child. And trust me, I respect this so much. But that is why I'm also making this video, so that you can be enlightened and you can also enlighten others. So please like this video and share, so that people can learn what is right from what is wrong and help their children grow in perfect health. So Jen, thank you so much for joining me again today. I remain your baby's doctor, Yourbabysdoctor, shining lights on your child's health and well-being. Do well to follow me on social media at Yourbabysdoctor. And if you have any questions, comments, please drop them in the comment section below, and I'll be here to answer. Thank you so much for joining me. See you next time. Bye.